I assume you landed on this presentation because you're concerned about hair loss or the potential for hair loss. Maybe it's just starting to thin. Maybe you're already in the point of significant receding hairline. Whether you're male or female, hair loss is very personal and it does affect self esteem. And we are very sensitive to the variety of conditions that can create this. In any event, this presentation is really about how to choose what is right for you and how to ask the right questions and what does it take to have a support system that allows for the evolution of your hair growth through your lifetime. So we're going to start about thinking about how you choose a hair restoration center. I'm Dr. Patrick Felice, a double board certified plastic surgeon, and I've been in this business for over 35 years in both the plastic surgery arena, med spa services, as well as hair restoration. If you're thinking about hair restoration, I want to stress firmly that this is a process that you should follow with a physician for your lifetime, essentially. And I'm going to open up by talking a little bit about going overseas versus doing your procedures in the States. So if you're thinking about Turkey, what every hair transplantation patient should know before booking a hair transplant. Every year, thousands of people travel overseas for hair transplants, hoping to save money. Some achieve excellent results, others come home with questions, complications, or outcomes they never expected before you make one of the most important decisions of your life. Let's look at everything that should factor into your decision, not just the price. So, why Turkey? Well, Turkey has become one of the world's largest destinations for hair transplantation. Lower operating costs, high patient volume that allows many of the clinics to advertise prices that are genuinely difficult for American practices to match. Understanding why those prices exist is the first step toward making a truly informed decision. They have lower labor costs, significantly reduced wages compared to what we need to pay U.S. clinical staff members, and that drives most of the price difference. They have very high volume clinics. Many clinics operate on high throughput models, treating multiple patients simultaneously each day. Their package pricing, they offer all inclusive bundles, combining procedure, hotel transfers that really create this, amazing single number. Let's face it, the medical tourism industry is a robust infrastructure of facilitators, agencies, and brokers actively marketing these packages worldwide. So let's address the price question. Is it really less expensive? Now, price comparisons are often far more complex than the advertised procedure fee. Travel, lodging, time away from work, and follow up care all contribute to the true total cost of going overseas. In Turkey, here's the full picture. There's a procedure fee, the round trip international flights, hotel for the recovery stay, time off work for travel and healing, unexpected out of pocket expenses, return travel if complications arise. In a local practice, there's the procedure fee. Some provide local transportation. You get the follow up care included, immediate physician access, almost as if a concierge practice where you can call anytime, no travel disruption to your healing, and continuity of care from day one. I can't stress that enough. It's the continuity of care. Now, hair restoration is not a vacation. The procedure lasts one day. The healing process lasts months. Hair transplantation isn't simply about surgery. It's about how you're cared for in the days, weeks, and months that follow. Flying home immediately after surgery introduces real risks that are easy to overlook when browsing package deals. There's swelling and discomfort. Postoperative swelling typically peaks 48 to 72 hours after surgery. That's often during your return flight home. Precise aftercare, specific washing protocols, scalp care routines. These have to be followed exactly to protect any fragile new grafts. Sleeping at the correct angle is critical in the first week to prevent graft displacement and swelling. Now, it takes months of healing. Full results take 12 to 18 months to emerge. Ongoing monitoring ensures your progress is on track. Now, these are questions every patient should ask before committing to any clinic, whether it's overseas or at home. These are the questions that reveal whether you're in expert hands. The answers will tell you more than any price lift and or any before or after gallery. Who designs my hairline? Hairline design is an artistic and medical decision. It should not be made by anybody other than a qualified physician, not a technician. Who extracts and who implants my grafts? In many high-volume clinics, unlicensed technicians perform the core surgical steps. Know exactly who's doing the surgery. How many patients do you treat in a day? Physicians seeing multiple patients simultaneously cannot give your procedure their full attention. Who follows me afterwards? Postoperative care and long-term monitoring are as important as the surgery itself. Confirm who owns that relationship. What happens if something goes wrong? Complications don't appear before you fly home. Understanding exactly what recourse you have from thousands of miles away is important. Now, technology and expertise do matter. We're considered one of the most comprehensive hair restoration centers on the East Coast because not all hair transplant procedures are created equal. Hair texture, curl pattern, donor density, scalp health, the trajectory of future hair loss, these all influence which techniques and technologies will deliver the best, most natural result for your specific situation. Robotic hair transplantation. Now, this is an AI-assisted precision instrument for consistent graft extraction with minimal scarring and maximum survival rates. It's only good for straight hair, however. So to be a complete clinic, we also use the NeoGraft technology where we can extract by hand automated follicular units, extractions that decrease handling time and improve graft viability. There's also the microscopic graft preparation, careful dissection of the follicles, creating 1 units and 2 units and 3 and 4 units so that when you place them in the recipient site, they're distributed in a way that creates the most natural hairline. The other thing is that preoperatively, you should have an advanced scalp analysis. Look at donor density, create a personal treatment guide before any graft is placed. Hair restoration is not one procedure, it's a lifetime plan. The transplant is only one chapter in a much longer story. Hair loss is a progressive condition. There's no doubt that it will progress. Without a long-term strategy, even a beautifully executed transplant can look very much out of place within a decade. A comprehensive approach protects your investment and your appearance for life. So we use this chain of events, diagnosis is critical. It should be done by a physician that understands the process of hair growth and hair loss. Medical management should always be considered before delving into many of the invasive procedures. Hair preservation. What do we do for hair preservation? Do you use PRFM? Do you use topicals? Do you use other techniques that might preserve the existing hair? Eventually, you might need transplants, but then there's future planning. What do you do to maintain those transplants, maintain that additional hair loss? Each of these stages builds on the last. Skipping steps, especially diagnosis, medical management, and future planning, it's one of the most common reasons patients end up needing repair work down the road. When things don't go as planned, these are repair cases. Some patients seek our care after procedures are performed elsewhere, domestically or abroad. Repair work can often meaningfully improve appearance and restore your confidence, but it is also very complex, more expensive, and more limited in the outcome than getting it right the first time. What are some of the reasons people see us? Overharvesting. Removing too many grafts from the donor site depletes the supply available for future procedures. Low density in the recipient area. It creates thin, unnatural appearance that typically disappoints patients. An unnatural hairline, poorly designed hairlines, too straight, too low, or with a pluggy texture. This can be very difficult to correct. Scarring from strip scars, wide FUE punch scars. This requires very specialized techniques to minimize their visibility. Overall, donor depletion is the number one problem. If the donor supply is exhausted, you've eliminated all future transplant options. And this is very difficult when there's not enough hair to do anything in the future. So, what makes us different? We offer every proven hair restoration modality under one roof, guided by a single physician, myself, who knows your history from the very first visit to your final follow-up years later. We offer both robotic and NeoGraft hair transplantation. We treat both males and females. We treat all ethnicities and all types of care, and we have particular expertise in curly hair. We have full medical hair loss treatments. We provide long-term follow-up. And again, this is lifetime planning. So we can understand how your hair grows going forward and try to guide it in that way. So know before you decide. Comprehensive hair restoration evaluation takes hair density mapping, donor assessment, future hair loss projection, and a personalized treatment roadmap. These are all options that are discussed openly and honestly, including whether surgery is even appropriate for you at this time or ever. Your hair deserves more than just a quote. Your hairline, your confidence, your future, these are permanent decisions. They deserve careful thought, expert guidance, and a physician who will be with you not just on procedure day, but for the years that follow. Before you book a flight, let's book a little conversation. If you're thinking about Turkey, before you book, get your comprehensive hair restoration evaluation. Take the first step toward a decision you'll feel confident about for the rest of your life. Our team is here to answer every question, and no pressure or agenda is inserted. Just honest, expert guidance. You can visit us online at youthfulimages.com/hair/hair-restoration, or give us a call directly. Speak to our patient care team at 860-242-0505. Believe me, utilizing these steps and answering these questions before you make a decision based on price only is something you will never regret. Your future hair will certainly thank you. Appreciate your time. Thanks for listening. Take care.